Hey everybody, this is Chris DiMatteo. I'm the Law Talking Guy. And on today's show, which is we release as a podcast and also a video for video viewers, I have one of my oldest friends, Dr. Steve Engstrom, who is here from Tennessee. Steve?
Yeah, hey Chris, thanks for having me on. I've been looking forward to this for a while. So as Chris said, I've known Chris for 35 years now. And I'm Steve Engstrom. I'm an orthopedic surgeon. I work at Vanderbilt University Medical Center in Nashville, Tennessee. I've known Chris ever since we were kids, and I grew up in that area, but moved down here to start my practice. I mostly do total joint replacement, hips and knee replacement surgery, but I've got pretty significant training in general orthopedics as well, so I can talk to sports injuries and youth athletics and stuff like that. So
yeah. So again, Steve and I are probably each other's oldest friend. We can't remember a time not knowing each other, but the time must have existed because I'm older by about 9 or 10 months. So yeah, there was that time. But no, we grew up in the same town. We didn't go to school together, and we went to the same school except for high school. We both went to BC, although we were in different years. I then went on to become an attorney. Steve became a doctor. Anyway, I wanted to bring you on this because it's hard to, as much as I want to avoid talking about this pandemic, it's all over the place. The fact is, it's all over the place. So it's hard not to think about it. It's hard not to talk about it. I think probably one of the better things we can do is talk about it and possibly answer some questions people might have. Certainly questions that I have. And usually we talk about, usually it's just me talking about legal issues, but here we have, I think, some good medical topics to talk about, as well as just general health. And I'll probably get into some legal issues later. But so you're an orthopedic surgeon, you're not an ER doctor. How's this affecting your practice and your life in the medical profession?
Yeah, so that's a good point. So I'm not an ER doctor. I'm not an epidemiologist. I'm not an infectious disease specialist. I have been affected by this pandemic, probably exactly the opposite as to all of those specialties. They're the ones who we talk about physicians and nurses being on the front lines. They're truly the ones that are on the front lines battling this pandemic, putting themselves at a great deal of risk, seeing people who may or may not have the virus at every turn. My practice has been affected in the exact opposite way. I am a surgeon. I do 95% elective surgery. So I'm among the group of surgeons and physicians who have basically had to shut their practice down.
Right. Actually, before we do that, I don't want to interrupt you too much, but just so you let everybody know, what's elective surgery and what's, say, a non-elective surgery?
Yeah, that's a really good question. And I think that's caused a lot of issues as how the public has seen this pandemic and how physicians and surgeons. The true definition of elective is a little bit hard to pin down. And every hospital, every physician group, every state has taken a little bit different approach to what's elective. You can look at it in the pure black and white as if you talk about surgeries in 3 categories as emergent, meaning they have to be in the operating room as quickly as possible. There's things like heart attacks, or if you have to do an emergent bypass or heart catheter, that would be an emergent surgery. Urgent, meaning it probably has to be done in 24 to 48 hours. That's probably something like an appendectomy, or in the world of orthopedics, a open fracture where the bone's actually protruding from the skin. It's probably something that has to be done in 24 to 48 hours. And then elective, everything else, which is a huge, broad, wide category.
So elective, though, that doesn't mean it's like cosmetic surgery, like breast enhancement surgery. Elective just means it doesn't have to be done right away, right? Is that?
Yeah, that's the really raw definition of it. Now, my practice spans everything right up to and including that urgent, more urgent procedure. If somebody comes in with an acutely infected hip or knee replacement, has a fever, is starting to get sick, that's a more urgent procedure. It's not emergent, but certainly something that I'd want to do within 24 to 48 hours to prevent a negative outcome. And then I have, 75-year-old patients with hip and knee arthritis that have been dealing with these chronic conditions for sometimes 10, 15 years. And whether they have their surgery tomorrow or 3 months from now, it really doesn't make a difference as far as their outcome. That's the sort of truly elective. Everybody hears elective, and that's exactly right. They think breast augmentation or plastic surgery, but a lot of what's done in America today as far as surgical intervention is elective.
Okay. So you said that you've cut down on elective surgery. I mean, as in are you doing any surgery right now?
Yeah, so I have not operated actually in a couple of weeks. Really, I have taken a pretty conservative approach to this. And what I've basically said is if it's an acute infection, like I talked about, or some type of a fracture surgery, those are the only ones that I'll really do right now. Our hospital system has taken a pretty conservative approach as well. And they basically said that if you fear that the patient's outcome will be negatively affected by waiting about a month, it's a surgery you should be doing. And I think that's a pretty reasonable way to look at it.
Yeah. So who schedules your surgery? Is it something, a patient needs something done and makes an appointment? Is it the hospital that schedules things for you?
Yeah. So in most physician practices, in mine included, usually how it works is it starts with an office visit with me. Most patients are either referred to me by a primary doctor or another orthopedist who doesn't specialize in joint replacement, or sometimes it's self-referral. It doesn't always take a medical professional for somebody to know that they have a painful hip or painful knee that's probably arthritis. So they start with an office visit with me. I see them, I evaluate them. If I think they're a good candidate for surgery, we talk about that in the office. And if they want to proceed, usually I have a surgery scheduler who has access to the OR schedule, has access to my calendar, and can help find a date for the patient that's mutually agreeable to myself and the patient.
All right. Now you said that not to do surgeries if it could cause a negative outcome.
So if we fear that waiting more than a month will have negative impact on the patient, that is a surgery we can and should be doing during this pandemic. If we feel that it is okay to wait a month or two, those are surgeries we should hold off on.
So what's the reasoning for cutting down on elective surgeries? Is it just to preserve hospital resources, is there a greater potential for things like infection if you're in a hospital with COVID patients?
It's probably multifactorial. In some of the more hard hit areas, the hospitals are having to divert all of their resources towards treating these patients. So masks, gloves, gowns, respirators, beds, they're actually turning, if you think about where can a patient have a breathing tube placed, it can be in the emergency room, in the ICU, or the operating room. So if all of the ICUs get overwhelmed, the next most logical spot is to start turning operating rooms into ICUs because they all have ventilators capable of caring for a COVID patient. So that's probably the first part of it, is just resource management. The second is what we know now about how many people who have this virus that are simply asymptomatic and could be shedding it and possibly putting other people at risk. It's if you don't have to bring somebody into the hospital, you probably shouldn't right now.
Yeah, even before you went to these prioritizing surgeries, did you have patients who were canceling or trying to postpone surgeries themselves because they're worried?
Yeah, a handful. It wasn't as common as I might have thought it would have been. Arthritis is a pretty painful and debilitating condition, and people plan their lives around these surgeries. They have fairly extensive recovery times. A lot of times they need to have family members come into town to stay with them or provide care before and after surgery. So it's a pretty big commitment that the patient makes. And with the amount of pain that they're in before surgery, usually they're ready to go. And I've found in more cases than not, I've had to be the one to call a patient and say, it's probably not the right time. This is probably something we should wait on. We don't want to put anybody at risk by bringing you into the hospital.
Yeah, no, I think that makes sense to me. I mean, I don't like going to the hospital at all. I don't think anyone does, but it seems like that's the worst time to be going to a hospital. So you mentioned something about hospitals having to, we didn't use the word ration, but I guess utilize their protective equipment. So in the news we've been seeing, especially up here, because we're in Connecticut, I know New York City is national news, but we've been seeing a lot of New York stuff and how hospitals are very low on things like masks and gloves and gowns. And we put in PPE, but is that personal protective equipment? Is that the right?
Yeah.
So yeah, that phrase has entered our lexicon. N95 mask has entered our lexicon as well. I don't know a whole lot about those things. I don't know how many people really know about them other than seeing those words and phrases written. What can you tell us about, like, okay, I guess, yeah, just generally, what PPE do doctors or nurses usually wear, and how often do they go through it?
Yeah, so it is, it's interesting because I didn't know that we'd ever get to a point in our society where every person would know what an N95 mask is, or at least have heard that name before, because it's a pretty specialized, I don't want to say specialized as in complicated. It looks not a lot different from just a standard surgical mask. It just has a really specific utilization. There's basic personal protective equipment that every hospital worker, first responder, and even people who work in the food service industry use every day. And that's gloves, just standard rubber, latex. They used to be called latex gloves. Now they're all made out of a non-latex synthetic material for allergic purposes, but just standard latex gloves like you'd see that come in a big box, and there's 100 or 200 of them in the box. That's something that most nurses and doctors use a different set. They just pull them. There's boxes on the walls. They're small, medium, and large. They pull a different pair of gloves every time they touch a patient. Most obviously in the office, a lot of times we don't wear gloves to examine a patient, but if we're ever doing something like drawing blood, like nurses are drawing blood or giving injections, we'll just use standard gloves. When you start getting into the world of inpatient medicine, patients admitted to the hospital, there's different layers of precaution. And basically the bottom layer is you should be using standard protective equipment for all patients, which is gloves. If you're going to be handling an IV or any way, shape, or form in contact with bodily secretions, blood, sputum, anything, you should be wearing standard latex gloves, what I'll call latex gloves, even though they're not latex. Certain patients who have different infections, you have to change that level of personal protective equipment. If somebody has a bacterial infection, MRSA or MRSA is very, common out there, common terminology that people know. It's a antibiotic resistant form of staph, which is a ubiquitous bacteria that's everywhere. Those people are put on something called contact precautions, which basically means in addition to the gloves that you wear, you have to wear a disposable gown, which covers your arms and chest and your upper legs every time you go in and out of that patient's room. And it's changed every time you go in and out of the room.
So it's not just per patient, it's per entry
in general.
So if you go into the room 3 times for one patient, that's 3 sets.
Yeah.
So that's actually what surprised me the most. Actually, that surprised me just now. I didn't know that. I assumed it was per patient. I didn't know that all of this stuff was disposable. I thought there was still, cloth masks being used, and then it was laundered and bleached.
No, so we have made a transition to almost every single thing that we use is disposable. Certainly in the hospital, up on the floors, these gowns, they're very thin, sort of cotton-like material.
It was like a paper towel, right?
It's not even as thick as a paper towel. I'm trying to imagine as to what. Sometimes they're actually like a plastic, almost like a disposable tablecloth that you think going over a picnic table. Okay. That sort of vinyl-y type. Some of them are that. Others have more of a cloth feel to them, but they're pretty thin. They're just a standard barrier. You put it on before you go in the room. You take it off before you leave the room. Every time you go in and out of that patient's room, because the thought is if that patient has a bacteria that can be spread to another patient on the floor, you always want to have something, a barrier between you and that patient, especially as a nurse who's taking care of 2, 3, sometimes 4 or 5 patients just to themselves. They don't want to be giving that to any of their other patients. And then, of course, physicians who I may be seeing 15 different people all over the hospital, you don't want to take that to different units. That's what's called contact precautions. Other diseases have different precautions. There's something called droplet precautions, which is what you'd think of. So in those scenarios, you would wear gown, gloves, and then you would add a standard surgical mask, which is just like you see in the TV shows ER. It's a rectangular mask. It's got 4 strings on it. You tie it around the back of your head and around your neck, and it goes over the bridge of your nose. And it looks like the cloth masks that are being made to sort of wear in public now. No, it's just, what you think of.
Yeah. No, so a surgical mask doesn't actually filter anything, right? At least
it's just a barrier.
Yeah. And it's 2 ways, right? So like part of that is so you don't get anything on a patient,
right,
performing surgery, but it's also so something's, whether it's blood or spit or just vapor, right? Like to keep it from.
Yeah, exactly. Okay. And then above that is what's called airborne precautions. Those are for people who have respiratory. So droplets are obviously large particles from a sneeze or a cough. They're sort of, if you were to cough into your own hand, your hand gets wet. Those are the droplets. That's droplet transmission. Above that, you have something called airborne precautions, which are much smaller particles. They stay in the air for a much longer period of time. They're aerosolized, which is what you hear now on the news about COVID-19. It's an aerosolized respiratory pathogen. And for that, you need something with a much higher level of filtration. And that's where these N95 masks come in. They're much thicker. They fit much tighter. Actually, it is something that you have to be fit for an N95 mask. It's a process. Yeah. Every hospital employee in America has been fit for an N95 mask. Basically, they put you in this, they give you a mask that they think is going to be the right size. You put it on. They put you in sort of this bubble where they spray saccharin or a sweetener into the air. And if you can taste or smell that sweetener, the mask isn't fitting right.
Oh,
so.
All right. So if I'm one of those people that somehow acquired a bootleg box of N95 masks I wanted to use personally for when I go to the supermarket, but I just put it on and walked in there, it probably wouldn't be accomplishing much.
I'm glad you asked that and said that, because it really, like I go out and I see people wearing N95 masks. 95% of the time, they're not the right size for the person that's wearing them. 99% of the time, they don't have the straps where they're supposed to be, and they're just not working. It should be uncomfortable to wear an N95 mask. Yeah, you feel like you're suffocating when you wear one.
That's what I read. I read that because it filters, it's such a strong filter. I mean, it's 95%. It is hard to breathe through that. People that have either existing respiratory issues shouldn't even wear them because they won't be able to breathe.
Yeah.
So actually, I was going to add, I know it's not hospital stuff. Are you noticing you're in Tennessee, so you're in a more southern state, even though you're in Nashville, so you're in an urban area. How are people, as individuals, handling the social distancing and the masks and gloves, if any?
Yeah, I've noticed it's variable. I really try, I don't have, I still have to go into the hospital. I still have to expose myself to some degree to this. So when I'm at home, I really try not to go anywhere. I try to stay at home or stay around. I try not to go out to stores. I did have to go out today, and I saw more people than I had seen in the past wearing masks and wearing gloves. I understand the masks far more than I understand wearing rubber gloves around. They don't do, your skin is a barrier. Your skin is a better barrier than any rubber glove that you put on. And if you touch everything with those gloves, and unless you're constantly taking those gloves off and putting new ones on, you're really not accomplishing anything. The key is to not touch things and then touch your face.
Right.
So if you're out and you're conscious and you're diligent and okay, I'm not going to touch my face until I can sanitize my hands, really doesn't make a whole lot of, you're not adding a whole lot by wearing gloves, except if wearing those gloves reminds you not to touch your face.
Yeah, I mean, I always think that if you wear gloves, some people might touch more things because they
Yeah.
figure, hey, I have gloves on.
Yeah. Yeah, absolutely.
So in Connecticut, Governor Lamont issued another executive order. It doesn't take effect yet. I think it takes effect in a few days, next week. Ordering the wearing of masks in public places when you can't social distance. So one of those kind of tricky things. Like basically saying if you're going to be close to people, you should wear a mask. But what are your thoughts on public mask wearing? I mean, it seems like it's being recommended, but I saw some other opinions that say they shouldn't be worn as a substitute for doing the other things, and that could actually be a problem if people wear the mask and then stop doing other stuff.
Yeah, I agree. I think if you look at the countries that have really done a good job with this, and it's a lot, and by and large, South Korea, Singapore, China, or Japan, they have a culture where they're so densely populated that you see people wearing masks in public in non-pandemic times.
That's what I've heard.
It's part of their culture. It works. It is more effective in preventing you from transmitting a virus that you don't know you have, rather than preventing yourself from becoming infected. So it's actually it's sort of a respectful thing to do for you to wear a mask, because you're not so much protecting yourself, you're protecting everybody else from you. I don't think it's a bad idea. I don't know how effective these cloth masks are at really anything. I think if you have to go to like you said, I think if you're predominantly staying at home and only leaving the house when you have to, and you're going to put a mask on for those few things that you have to do, great. It's not a blank check. You can't just, because you're wearing a mask, you can't just go back and start doing whatever you want. You're less safe doing that than you are just limiting your travel.
Yeah, that's kind of what I was thinking. I mean, especially with, I think the mask, I mean, right, it prevents you from, or at least it cuts down on infecting other people. But yeah, I think you could also just, watch yourself when you sneeze and cough and, and that sort of thing. So right, it probably won't hurt anything, but there's always an opportunity for people. Of course, people are making and selling masks now out of cloth online. I guess it's not a bad thing, but you always run the risk of, people buy stuff that they think works and they really don't because someone might have cut out of a pattern and sold on Etsy.
Yeah,
they're not rated by the FDA.
Yeah. Yeah. Personally, I've not worn a mask when I've gone out, but I wear one in clinic when I see patients, but so yeah, I'm not totally sold on the public mask wearing yet, but that's just, there's not a lot of evidence, I don't think, one way or another. It seems like it seems like a logical thing to do.
Yeah, right. I don't think it really hurts anybody.
Right.
So it should help.
Right.
Yeah, then I guess general cleanliness. I mean, one of the things that came out early. First, I never knew they should wash your hand. I always wash my hands. I didn't know 20 seconds was the magic number.
Yeah.
But all right, I guess better people wash longer than not. No, I saw that at one point it was hard to buy hand soap at stores. Did people just start washing their hands now? Like, have they been doing this?
No, I mean, I think effective, hand hygiene is something we're very big on in the medical field, obviously, when you're touching multiple people. And it's probably one of the things that one of the few good things that may come out of this pandemic. I mean, people should know how to effectively wash their hands. I mean, this is theoretically something that you learn in kindergarten, but I think it's important to have a refresher for adults who may not be doing it. I don't think that we have to go overboard and you have to be constantly sanitizing your hands with Purell every 5 minutes, but you should know how to wash your hands.
Yeah, I agree. I mean, I also think that, one small thing that I think would be pretty helpful. When you go to the grocery store now, at least up here at Stop and Shop, they have dispensers of wipes, so you can wipe your hands, wipe your shopping cart.
Yeah.
And it's one of those things that, yeah, I don't blame anybody for not really thinking about that before. But now that we know to do that, that could probably help just common cold and seasonal flu and
Oh,
things like that.
absolutely.
And it's a
Absolutely.
really easy thing to do.
Yeah.
So that would
Absolutely.
be a good thing to take from this. Again, I think general hygiene and general health is good regardless. As for household cleaning, I don't think that's really going to change much one way or another. People are either clean and neat or they're not.
Right.
But yeah, I think hygiene certainly good. We want to see more of that. If anything, maybe you're culturally a bit behind when it came to.
Yeah, I agree.
People that overdo it and the people who underdo it. If everyone can get up to just doing it, I think we'll be pretty good. I think being considerate of others could be a lesson that comes out of this. Yeah, of course you weren't. I mean, no one should have been sneezing and shaking hands.
Right.
Maybe people will not forget as much. Handshaking is one of those things that culturally we've been doing for a very long time. Maybe we move on from it and do, a nod or something else.
Yeah, I think handshaking is just so far ingrained into American culture that it's going to be hard for us to give that up. But it may not be the worst thing if we end up giving that up.
Yeah, I mean, again, old habits die hard, and that's an old one. I mean,
it's
habit. I mean, it's going to be tough for me to not shake hands when I meet people because
we've
all been doing it. But yeah, I mean, I think it's one of those things that's worth considering, and seems like the cost of it really wouldn't be much of anything, and the benefit of it might be something. I agree. I can't think of anything else to talk about with this pandemic stuff. I just wanted to talk about just general medical and health questions. But I want to focus more on your specific practice. Being an ortho, I think everybody knows what orthopedics are, but if you just explain the types of things you work with, whether they're bones, muscles, or...
Yeah. So I say it to my kids when my kids ask me what kind of doctor I just tell them I'm a bone doctor. I mean, that's what an orthopedic surgeon is. People hear the word orthopedic, and a lot of times they think of orthopedic shoes, so they think we're all foot doctors. That's only a small part of us, are foot and ankle surgeons. It's basically any bone, tendon, muscle, and then including the spine is all in the realm of orthopedic surgeons. Most of us have some sort of subspecialty. So hip and knee replacement is one, pediatrics is another, spine is a third, sports medicine, which is basically mostly if you have an arthroscopy or a scope of your shoulder or your knee, those are by the majority sports medicine trained surgeons. Foot and ankle, and I'm sure I'm forgetting one or two, but hands, and then hand surgery.
Right. So one thing that I know you've been doing, because you've been published on it, is hip preservation.
Mm-hmm.
So what's that about? Like preservation as opposed to another approach you might take?
Yeah, so it's preservation as opposed to replacement. So 95% of what I do is hip and knee replacement surgery. Probably 5 to 10% of what I do is what's called hip preservation, and I also call it young adult hip surgery. So it's a very broad category of hip disorders. And some of it is congenital, sort of the way the hips were made. Some of it is sports medicine. When you hear of athletes who have hip labral tears and need arthroscopic surgery to fix labral tears. Some of it is and it's really just the span of pre-arthritic surgeries to to fix hip deformities or hip pathology. We do hip replacements by and large for hip arthritis. So the goal of hip preservation is to fix problems with the hip that can ultimately lead to hip arthritis, labral tears, structural abnormalities, and problems with the articulation of the ball in the socket.
So is it something that could completely prevent the need for replacement, or really just push it out farther in the future?
So the goal is to push it out farther. We hope that in certain patients it actually It may mean that they never have a hip replacement. However, what we thought, nobody knew 10 to 15 years ago what would happen with this or with hip replacement. And what's actually happened is hip replacement has gotten better and better and better, so that it's actually it's actually easier to offer somebody a hip replacement now than it was 10 or 15 years ago. People used to look at hip replacements as a failure of these hip preservation procedures. Hip replacement is such a phenomenal surgery. It's the best surgery that I do. It's the best surgery that we do in all of orthopedics, that I don't ever have a problem recommending a hip replacement, regardless of the patient's age, if they have a problem that needs it. I've done hip replacements in patients as young as 11 or 12 years old.
Oh. So what's gotten better about the surgery? Is it the actual devices that have gotten better? Is it the techniques? Is it the rehab?
Yeah. So it's all of the above. It's what I tell every patient is the biggest game changer that we had in hip replacement surgery is it's by and large, it's a metal shell that goes into the patient's pelvis, a metal stem that goes down the hollow part of the femur or thigh bone. And then what you put in between those two things has changed a lot over the years. It started as a plastic liner inside of the shell, and then a metal ball, so that you have metal rubbing on plastic. It's gone. Some people still actually do this, ceramic on both sides, so a ceramic liner and a ceramic ball. There's been metal on metal, which if you've ever been at home during the day and you've seen one of the million commercials for lawsuits for metal on metal hips, that was a pretty big failure. What I use, but about 15 years ago, we changed the kind of plastic that we use on the liner side, and 20 years out, those have no noticeable wear, because that was the big problem with older hip replacements, is the plastic would start to wear down and cause problems. And we have not seen that with the new kind of plastic, which we came out with about 20 years ago. So it's been a dramatic improvement as far as implants. Technique has gotten better. It's way more, the recovery time's a lot faster now. Patients can go home the same day as surgery. You can really do a lot of higher impact activities on them. I tell patients they can run on hip replacements. So,
and do you have any estimation as to the number or percentage of adults who will eventually need a hip replacement?
Oh gosh, I mean,
really, that's why I was asking.
It's very common. I was pulling the data actually recently. Let me see if I can find it here as we start to talk. But the procedure was way more common. I mean, we do millions of hip replacements a year, pretty much.
I don't think any age, but it almost seems that if you live long enough, something needs to be replaced. And
yeah.
My two grandfathers who both passed away in the past 5 years. One had, I think he had a hip replacement. I think he actually had a replacement of the replacement at one point.
Yeah.
Then my other grandfather had both of his knees replaced. And anecdotally, I could think of just numerous people I've known or been related to that have just had, whether a knee replacement, hip replacement.
Yeah.
It's very common.
It's very common. The predictions are that by the year 2030, we'll be doing about 2 million total hip and knee replacements a year.
Yeah.
About a little over 1 million total knees a year and about 700,000 total hips a year.
Yeah, I believe it. So going into sports,
mm-hmm.
You and I both like sports. We all know that. We've been talking about watching sports together for years, whether it's at BC or somewhere else. And sports, people get injured. Being a baseball fan, or just being a sports fan in general, I think most of my knowledge of bone and ligament tendon injuries come from athletes. And I wouldn't know what an ACL or an MCL were if I didn't have an athlete on one of my teams that tore one.
Mm-hmm.
I guess what are the most common sports-related surgeries that you do?
Probably the most common is, so I don't do, personally, the only sports in related injuries that I do that I treat are hip labral tears and hip disorders that can occur, either hip fractures that go poorly or hip labral tears are the only ones that I do. The most common sports related surgery that you'll probably hear about is an ACL reconstruction. They're very, very common. A high percentage of athletes who, do competitive athletics might end up needing one at some point. Obviously, it's more common earlier in the once you get to the professional level. Most of those athletes haven't needed one. A lot of times an ACL is sort of the thing that can make or break an athlete's career. The younger you are, if you have an ACL tear, the less likely you are to go on to do professional athletics. We don't know if it's a genetic thing, but certainly you do see a fair number of professional athletes who have ACL tears, have them reconstructed, and go on to have very successful careers.
Yeah. Are there any sports where an ACL tear is more common than another?
I think the two most common, and I'm not 100% sure on this, but I'm pretty sure the two most common are soccer and basketball. Probably soccer, I think, is the highest.
Well, yeah, soccer, I feel like I've seen it more in soccer. Is that just because the changing directions or sliding on grass? Like, is there?
Yeah, it's the pivoting and the changing. It's the pivoting and the change of direction. So I think in the high school level, girls soccer has the most ACL, and then boys football is actually is pretty high.
Yeah. I would think that, basketball is what probably has a lot of ankle injuries. Anything involving jumping would make sense to me. I heard that cheerleading is probably one of the most injurious sports for girls.
Oh yeah,
you're jumping, flying,
tumbling,
ankles. Football has a whole host of injuries,
right?
But in baseball, it seems that baseball injuries tend to be more overuse kind of injuries.
Yeah, absolutely.
Like a Tommy John surgery. I'm a Red Sox fan. Found out that Chris Sale is going to need Tommy John surgery. So what's that? What's it used for? And what's the real name of it?
Yeah, so Tommy John surgery is an ulnar collateral ligament reconstruction. It's a ligament on the inside of the elbow. It supports the elbow, gives the elbow. It helps give stability to the elbow. And if you can imagine, in baseball pitchers, as they're coming over the top and throwing the ball, it produces a lot of strain. And this is exactly what is the classic sort of overuse sports injury. It's why little league pitchers have pitch counts, and why they can only pitch a certain number of innings in a week. And it's all to prevent this overuse injury.
So one thing I've wondered, and maybe it's just because pitchers throw harder and throw more, but it seems like you only see this in pitchers. Do you ever see it in catchers? Because catchers are always throwing the ball back.
It's less common in catchers. I think catchers anecdotally tend to short arm the ball a lot, and they don't they're not throwing it with that fervor a lot. How many times in a game does a catcher need to make a throw down to second base or a throw down to third base? Probably not any more than a third baseman needs to make a throw to first base. It's just, you're getting a pitcher up there who's throwing with a high rate of speed, 80, 90, 100 times a game. And that's really what it is. It's just the number of throws that they have to make.
Have you seen similar issues in quarterbacks? Because they're often throwing the ball far downfield.
Yeah, I think so. As I said, this is out. The data on this is outside of my area of expertise, but I'm sure there have been reports of quarterbacks needing to have a Tommy John surgery. In quarterbacks, the thing you run into in professional football and football in general is you have the added factor that people are trying to tackle the quarterback. So he can, they're more prone to acute ruptures of tendons if they get their arm hit as they're throwing, or they hit someone's helmet, or They land on their non-throwing arms, so they have that added aspect of somebody trying to hit them every play.
Yeah, that's something I always wondered. And the thing, even so, you do Tommy John surgery for a UCL tear.
Mm-hmm.
Now, what? And again, I think most people, like, it seems like unless you pitch, you're probably not going to have that injury.
Yeah, probably not.
And
It's way less likely.
Yeah, and even if you did, like, if a pitcher tore a UCL and then didn't get the surgery, and what would that mean for his arm? Like, is it?
So usually the way they see it is they lose velocity. So if they have a clinically significant UCL injury, and generally they will lose velocity and will lose effectiveness in their pitching. So I think it's becoming way more common to see them fixed in high level baseball players rather than treated non-operatively.
Yeah, and I mean, it's easy for, again, if you're a big league pitcher, you've done a lot of throwing, so it figures by that point, I would say it's not unexpected. But I've seen, again, I think I sent you this article a few years back from Sports Illustrated about the growing number of tears and surgery in young pitchers, as in high school or region, like pre-college. And would you attribute that, or could you attribute that to just the year-round? Baseball?
Yeah, it's the fact that there's greater and greater subspecialization of sports among young athletes. They tend to gravitate toward one. The goal is now how can I use this sport to get a college scholarship or potentially make this my livelihood? So rather than seeing kids who in the past would play football in the fall, basketball in the winter, and baseball in the spring, it's travel baseball in the fall, conditioning for baseball in the winter, spring league, summer league. It's year-round play, and it's one thing that that orthopedic surgeons are trying, and pediatricians are trying to stress. It's breaks from sports, and variety of sports.
Yeah. So that brings me into, I think, a good segue. Now, you're not just a doctor; you're also a sports fan, but you're also a father. You have two boys who are big and are going, even though they're young, they're clearly going to be big guys, and they're athletic. Mm-hmm. So I guess they're probably going to be playing sports at some point.
Yeah.
And what ideas do you have in how you want to manage, or at least what to look out for? What precautions do you think you should take as a parent with the doctor, as a doctor who does this?
Yeah, my big thing is I want my kids to be involved in sports. I think there's a lot of important life lessons and just overall health benefits to being involved in team sports. I want them to be the drivers of the sports they play. So I have taken the approach of trying to expose them to all different sports: basketball, soccer, baseball, football, golf, and sort of seeing what they like. And I want them to have one or two or three sports that they play in season as they get older. But I think, you want to avoid burnout in young athletes, and you want to avoid injury. So, you don't, and really when I say injury, overuse injury. Anybody can tear an ACL playing basketball or playing soccer or playing football. And a lot of the times it's just bad luck. But you don't want to push a child, or even in some cases, allow a child to give themselves an overuse injury. Because you do, on rare occasion, have those kids that's all they want to do. And they just want to throw a baseball all day. And part of being a parent coach is knowing when to shut them down a little bit.
Yeah. And the way I see it, so I was never great at any one sport. It really was average at best in all the things I played. Maybe average was me being generous to myself. So I think it might make you a better player in one thing if you do that all the time. But I think it makes you a better athlete if you play different sports. A lot of the best athletes, a lot of the best basketball players, NBA players played other sports in high school.
Yeah, I totally agree. I think, I think you should be playing a different sport. If you really want to be an athlete, you should be playing a different sport every season, having that one sport that you look forward to all year. But, if your sport's football, do something in the spring that gets you ready for football, but it's not football. If it's baseball, yeah, I agree. I think variety of sports is shown to be a good thing for young athletes.
Yeah, I think physically it's probably better too. You're working on different muscles.
Yeah,
Um,
absolutely.
Obviously, you have skills that are common in everything, but it might be that baseball is a sport that requires a higher degree of, I think, hand-eye coordination.
Yeah,
Less muscle and speed, although those things certainly help.
absolutely.
But having the skills, being a good basketball player could probably really help you in football with some agility.
Absolutely.
And training is different too, because if you're training for the same sport year round, you're focusing on certain strength exercises, and it's not. Again, I don't think it's great for overall athleticism, but that's my take. I mean, I think there is a rise in injuries. I hope that you think that although there are greater occurrences of overuse injuries, that there's been a fair response to that, like the proper precautions are being taken with the pitch counts or.
Yeah, it's coming, and I think everybody realizes that it's a problem now, and there are a lot of campaigns to prevent it from happening and to keep the kids safe.
Yeah, that's really that's the most important thing. I mean, most people aren't going to be drafted to play anything.
Yeah. It's an extremely low percentage of people that end up going professional, and at the end of the day, sports are for kids to have fun. That's what I really think. So.
Yeah, I think so. Yeah, I mean, I almost think one of the overwhelming themes we have, whether it's preventing the overuse injuries, whether it's the hygiene and sanitation, it's that a lot of health issues, I want to say, can be prevented, but can certainly be minimized if we all just had more knowledge of these things, but also just took better care and responsibility of our own health.
Yeah.
I don't know how to quantify that, but I almost think that eating well, exercising, being clean, getting enough rest, that obviously avoiding things like smoking or drinking or other habits, that we could probably cut down on a lot of health issues later in life if we all bought into that.
I agree. Yeah, I mean, that's a good overall point. If you have to take a vested interest in your own health, and that's all of those things: good hygiene, good sleep schedule, good exercising, eating well, and you can prevent 90% of health issues by doing those things.
Yeah, I mean, I hope people learn the right lessons. I think this whole pandemic will be a learning experience.
Oh yeah.
I just don't know if everybody will learn the right things and if they'll actually use those things. I think we can just expect some gradual changes. Not, I can put it this way. It's 2020, and people still smoke cigarettes. Like we've known cigarettes are bad for well over half a century, more than that actually. Like probably around World War II, people knew that cigarettes were bad.
And the crazy thing is you would think that it would phase out, as the older generation that was part of that, the last remaining hanger-ons to smoking is like cool, as they get older. But I don't know that it's going away. You know what I mean? Like, I think young people are still smoking.
Yeah, well, and also that, but one thing that is completely, I think, preventable is vaping. And it seems like that's all over the place. Well, actually, here's one thing I'm wondering, and I don't know how much I don't know if anybody has thought about this. vaping seemed like it was pretty big for a little while among high school kids and I guess college kids. I wonder how it's doing now with kids stuck at home. As
Yeah.
in, I'm sure there are young adults or college kids who buy their cartridges or whatever they are, and they go home or go to work. But as for the kids who are using them kind of secretly, which I think were easy to do because they don't smell like smoke.
Oh yeah.
It can be done hidden. But if they're at home, they don't really have a way to get out and buy them. I have a feeling vaping is just gonna, again, maybe a good thing in this pandemic is that vaping just be decreased because there's just nowhere. Who knows? Maybe there are kids that are able to sneak vape in their bedrooms now. Maybe they have connections to get them. But it seems like that's one that's definitely going to drop.
Vaping is one of those things that, like, the idea of it seems good, right? Like, if you can take, people like mind-altering substances. It's why we drink. It's why we smoke. It's why, people do drugs. If you could take the feeling that you get from smoking cigarettes and turn it into something that doesn't destroy your lungs, like, it seems like a win-win. Like, it's a great idea in theory, but, in practice, it's probably not as good as we think it is. Now if you have somebody who's a 3-pack a day smoker and they manage to quit smoking cigarettes by vaping, I'd rather have them vape.
Oh yeah,
9 times out of 10, but it doesn't mean that 16-year-old kids should start doing it. Like,
that's how I see it. I mean, if you use vaping as a smoking cessation device, that's a good thing. I think that's why they were invented originally.
Yeah.
But if you just start vaping from nothing, it's a complete waste. Like, you're spending money, you're doing something that's unhealthy.
Yeah.
They're addictive. Not only that, but I think if people who vape ingest a lot more nicotine than people who smoke, or the equivalent amount, because they put a lot of nicotine in those things.
Yeah, nicotine is a highly addictive chemical. Like, it's crazy.
Yeah. So again, it was just one of many habits that when you think it's going to die out, it comes back in a different way.
Yeah.
Alcohol is not a healthy thing in moderation. It's something that can be enjoyed responsibly.
Yeah.
But that's not going to stop. I think people have done the right thing in drunk driving is something that has decreased sharply in the past 50 years.
Oh yeah.
So that's a good thing. People are drinking, but they're being more responsible of it.
Yeah.
But right, as long as it's not going to go away, so I think people need to learn moderation.
Yeah, I agree.
Yeah, actually, a pandemic with people stuck at home, that's probably not a way to cut down on drinking. Seems like there's a lot of drinking going on.
I think there was a report that like alcohol sales are up. Like, I actually know a guy who is a manager at a big liquor store down here, and he was saying they're doing the kind of business that they usually do around the holidays now. Like, people are just they're hoarding toilet paper, hand sanitizer, and booze, and it's like, it's crazy.
Yeah. Now one thing is that people can't go out to bars, so they're not drinking. So they might just be doing the same amount of drinking, but at home. But they also might be drinking more often because, hey, I don't have to go to work tomorrow morning. I don't have to go on the road.
Yeah, it's hard to, like, those societal pressures of, like, you shouldn't drink at 11 o'clock in the morning. Like, it's almost like you're on vacation. It's all like every day, so it's hard. It's like the days start to blend together. So yeah, I can see where there would totally be an uptick in alcohol abuse during this.
Yeah, I can see it as like, well, I'm not supposed to drink at 11 a.m. Hey, you know what else? I shouldn't have to go outside wearing a damn mask and gloves. Like, all right, point taken.
a pushback, yeah.
There are certain things that, of course, there's no shortage of opinions and people that need to write for a living, myself included. So of course you're seeing things about how society, like this is changing society. We're going to have video meetings and things. So you and I are doing a video meeting now, but we're also 800 miles away, 1,000 miles away.
Yeah.
I am going to say I am not a fan of all the Zoom meetings I'm doing. I am tired of seeing people during the day at home. How about we just do conference calls on the phone now? Or
Yeah. Yeah. So I think in sort of a larger perspective, like look at all of the people that thought that their job relied on them getting up every morning and going to the office, that have realized that they can be just as productive working at home.
Or what it also might mean is that maybe a lot of people aren't as productive as, as
Yeah,
they
or
hold
they
themselves out to be.
people just slack off a lot at work and now they're just doing it at home. So,
Yeah,
but I mean, if you're talking about like a societal impact, like carbon emissions, getting cars off the road, if 30% of the American workforce can now work from home, like that's an incredible impact that can be made.
yeah. Well, that changes a lot of things. I mean, it changes the way people plan their lives to a lot of extent. You might not, the story of the United States post-war is that of the car.
Yeah.
Because cars became prevalent and highways were built, people started moving farther away from the cities. They started commuting more. That led to so many other side effects, whether it's pollution, whether it's consumption, building houses, or environmental impacts because subdivisions were built, people were living in bigger spaces. It goes on and on and on. And, but if there's more remote working, then maybe they don't need to live in an urban area. Maybe they could spread out more.
Yeah.
Yeah, I mean, maybe it does open up opportunity for some.
I hope so.
Escape, though, is it's easy for people who are able to work from home and to work online to think that everyone can do that.
Yeah.
It's not true at all. You can't do your work online. You're a surgeon.
Yeah. Yeah, I can't. Now, I will say the one thing that we've done is so it used to be very, very difficult and in most cases not legal to do telemedicine services.
Yeah.
I've started doing a lot more visits over Zoom. And it's been pretty good. I really have enjoyed it. Patients seem to like it. I certainly like it. Like the fact of the matter is I can be just as effective in counseling a patient over Zoom as I can face-to-face in the office. So if it gives me a greater access to patients who may not be able to drive. I mean, I have patients who come to see me from all over the state of Tennessee. So if they don't have to drive 3 or 4 hours to come see me, like it's probably for the best.
Yeah, that's a good way to look at it, especially considering that you have patients who might have mobility issues to begin with.
Yeah, exactly.
Actually, I had an experience with telemedicine about a year and a half ago. It was Thanksgiving of the year before last. I had an earache. Didn't really know what it was, but my ear was bothering me for a couple days. And I think, is this an ear infection? If it is, I guess I have to go get antibiotics. But I don't want to go to the doctor the day after Thanksgiving. I'd rather have some relax that day. So I think it was Thanksgiving night. I went on to, and I'm not, I didn't have a primary care physician. So I figured, let me see my insurance company has. I don't even know where I can go. And I saw this telemedicine option. I figured, I'll try this. Like it's 10 o'clock at night. I'll try this. And that's way better. That'll be way better than having to wait in a waiting room somewhere tomorrow. And so I went on. I got connected to somebody somewhere in Connecticut. I don't know if he was from Eastern Connecticut or what. And I told him what was going on. And he said, he asked me a bunch of questions. I said, all right, it doesn't sound like an infection. It seems like it's just a fluid buildup. Here, do these things. Drink water, get some aspirin or ibuprofen, get some gum, get nasal medicine. And I said, whatever, I'll give it a shot. And actually, I did it, and it did work. And when you think about it, at least the way I thought about it, telemedicine makes a lot of sense because for so many years, doctors did practice without the ability, before technology gave it to them, of doing a lot of testing.
Yeah.
I would think that being a doctor, and the same way being an attorney, in that we need to be able to identify things based on what clients or patients tell us.
Yeah. Every physician learns in medical school that the most important part of a visit with a patient is what they tell you. It's the history. You get 90+% of the diagnosis from the history. So, and that's just as easily gathered over the phone as it is in person.
Yeah. So yeah, I think that's a good thing too. I mean, because if that could, from a public health standpoint, increasing people's accessibility to medicine, or at the very least medical advice.
Yeah.
Yeah, that's good. And if it cuts down on people having to sit in doctors' offices and get themselves to the doctor, yeah, it's definitely a societal benefit. So yeah, that's one positive. I'm not so sure what the negatives are, but we'll find those out soon enough.
Yeah. It remains to be seen.
Yeah, but yeah, I think that's yeah, so a lot to process. But also, I think we are at a place in society where we have all the tools. It's just a matter of using them the right way.
I agree.
We have the medical care. We have great technology. I mean, when you look at a lot of the stuff we do now, it really is stuff that people were thinking about in science fiction movies in the 50s.
Oh yeah, absolutely.
Like people are going to be able to see each other on the phone. Yeah, right. We're doing that.
Yeah, we're there.
Like voice activation. I mean, there are probably people who are making movies or comic books in the 50s. Like, yeah, you're just going to say something,
and it's going to happen.
This thing will do it for you.
Yeah,
that's happening now. I mean, it's happened for a while. So right, so all this technology exists, and I do think in a lot of ways, technology has actually advanced past our understanding, or maybe past our own responsibility. So figuring out it properly should work. But,
yeah, just like anything else, people have found a way to exploit the things that the options that they have in a negative way.
Yeah. Yeah, telemedicine, I think, is certainly something that's good one way or another.
I think it'll help. I think it'll be a very good thing.
Yeah.
But
anyway, I think that's a good end note. Today's show. We do want to make this a series. We have plenty of stuff to talk about. It seems we both have plenty of time to talk about.
Yeah.
I mean, I like doing this. This was obviously it's not hard for the two of us to fill time. And we've driven how many thousands of miles? Radio and some good conversation. So no trouble there. For anyone who's listening or watching and you made it this far, we probably will do some more entertainment focused podcasts. Before we started recording, we were talking about how we both got into listening to podcasts, and we owe it to Bill Simmons and Adam Carolla. The first podcast I listened to is Bill Simmons, the sports guy. I would read his column whenever it came out on ESPN Page 2. And then I started seeing fewer columns, but I started seeing the BS Report. I didn't know what that was. And started listening to it. And then when I would drive back from law school to home, I didn't have an MP3 player in the car or a USB port. So I would just burn episodes onto CDs and play them on the way back. And I think after that, Steve accompanied me for my trip back to Milwaukee, and we had a bunch of Simmons and Adam Carolla podcasts, and
I think we listened to the entire catalog that first trip back.
Probably. I mean,
there weren't that many of them back then.
No. And the thing is, so Bill Simmons is the sports guy. I'm not going to be the media mogul with Block 203 that Simmons is with The Ringer, but life is more than just the thing you do for work every day. I'm a lawyer, but obviously as a person, I need to know, and I think everyone should know, health information. So I think that's actually more important. People need to be healthy right now. But I like sports. I like music. You like music. We like movies.
Yeah.
So we can talk about all those things. So I think the next episode we do, maybe sometime coming days or next week.
Yeah.
Casino and casinos. The movie Casino, real life casinos and gambling, and I may ponder some other questions as to why there hasn't been a great movie about Chicago gangsters, because when you think about it, there hasn't been.
Yeah.
I mean, music, plenty we can do. So,
Casinos, shockingly large part of our young adult lives growing up in Connecticut.
yeah. I mean, again, the actual casinos, but the movie Casino. Like,
Yeah.
I mean, just think, I know we'll talk about more of this in the next show, but I think the reason why I like watching Casino, even though Casino is not my favorite movie, and I don't even think it's my favorite Scorsese movie. I think I like Goodfellas a little better. I like The Departed a little better. But Casino is a movie that's a collection of scenes and characters where I can jump in at any time.
Oh, yeah.
And watch it for 15 or 20 minutes or more.
Yeah.
I mean, I feel like there have been times when we were obviously in different places and texted the other saying, hey, Casino's on AMC right now.
Oh, absolutely.
Yeah,
more than a couple of times. Like,
yeah. So I'm looking forward to that one. I was thinking, like, what movie should we talk about? Oh, Casino was the first choice.
Yeah. Oh, it's the perfect one.
Yeah. So we'll do that. Then we have The Simpsons. A lot of episodes. We'd probably do a show on people do the desert island discs, the records you want to be stuck on an island with. We could probably do the same thing if you're stuck in it. Well, because it's really not a great thing being in a quarantine because not people have access to everything. But say there were some situation we were stuck with CDs, we can talk about our favorite albums.
Oh gosh, yeah.
So yeah, I'm looking forward to it. I'll tell you another good thing. Again, there are a few good things about a bad situation, but often there are silver linings. And one of the things that is almost ironic is that we've had all this technology for a long time to see each other online, to have these types of things. And after all these years, this is the first time we're doing it.
I know.
And
it's crazy.
What took us so long?
Yeah, it's crazy.
I
mean, it's amazing how you just get into your own like busy state and you sort of need something like this to kind of disrupt that a little bit and realize that you can do things like this.
Yeah, I think so. I hope people think more and learn more about what their priorities truly are. Won't hold out a whole lot of hope for that, but at the very least, maybe we could all think about it. And I'll admit, when things get back to normal or somewhere close to it, for me, my life probably will go back to the way it was before, where I was busy working and doing other stuff. But yeah, just finding time. Just finding time to have a good discussion.
Yeah.
It's worth a lot. I mean, I'll tell you, this was the highlight of my week. This was not a great week.
Yeah.
It was bad because there's nothing going on. It sucks. Like,
there's just nothing.
But I knew that, hey, I'm going to see you tonight. We're going to have a conversation about, it won't be a whole lot different than the time we sat in the upper deck in Busch Stadium talking about different things.
Oh, yeah. That was great.
So it's a good thing to do. So
absolutely. Glad we got to do it.
Late. Probably should adjourn for today, so I'll turn the recording off before we actually close out. Perfect. Thanks for having me on. Appreciate it. Thanks for coming, Steve. We could all learn a lot from each other, and I hope those who listen found it valuable because we'll be doing this again. So I'll turn off the recording now.